Hi, Roxy. My name's Emily. I'm your student physical therapist today. How are we doing?
Doing good.
Doing pretty good?
Hungry.
Me too. It's about lunchtime, so I'll get you out of here. So we're just going to run through two tests. One of them, I'm going to be checking your ankle range of motion, specifically your subtalar joint. And I'll kind of walk you through how we're going to do that, and I'll take your measurement there. And then you'll be laying on your stomach for that one. And then after that, I'll have you lay on your side. And I'm going to be testing your muscles, your glute med and min, which is innervated by your superior gluteal nerve stemming from L4 through S1 nerve root. And just testing like the nerve root integrity, make sure those muscles are activating. And we'll go from there. Awesome. Sound good?
Sounds good.
All right. Can I have you lay on your stomach to start, please?
Yep.
Alrighty. Is it okay if I touch you?
Yes.
Okay. So here I'm finding the medial malleolus and the lateral malleolus. And I'm going into the middle, bisecting the Achilles, which is where the subtalar joint is. So that's where my axis of rotation is going to be. My stationary arm is going to be lined, bisecting the two heads of the gastroc muscle. And then my movement arm is going to be bisecting the middle of the calcaneus. So doing that and lining that up, I am going to physically move your heel in the direction that I want to, okay? So I'm going to be everting. So I'm going to be pinching each side of the calcaneus, make sure I'm still in line here. And then I'm going to evert her without her whole leg moving. And then I'm just going to slightly adjust this, okay? Still bisecting the middle. Good, and relax. So I got 5 degrees of subtalar eversion. Normal is 5 to 10 degrees, so she's within that normal range. And then can I have you lay on your side? We're gonna face this white wall over here, okay? I'm just gonna hand sanitize because I did touch her feet. Alrighty, so for this manual muscle test, like I said before, testing for the glute min and med. Before I start anything, I'm just gonna palpate for those muscles. So is it okay if I touch your hip and glute area?
Yeah.
Okay. So I'm palpating for her iliac crest, which kind of like right here, kind of cup that. And then I'm gonna work my way down to kind of find the greater troch. And to kind of confirm that, I'm just gonna kind of take her leg in and out. Good, and it kind of pops and moves into my hand. So between the greater troch and the iliac crest is gonna be where your glute med arises, kind of like a pizza shape. So I'm gonna place my hand where I believe the glute med to be. And then can I have you straighten this bottom leg for me? Top leg.
Sorry.
Sorry, that was miscommunication. And then can I have you kick up into my hand? Good, and then that kind of pops out. And then same thing, still in that greater troch. I'm gonna take her leg, I'm gonna put you in a little bit of flexed hip, about 30 degrees of flexion. And I still want you to kick up into my hand, okay? Go ahead and do that. Good. And with my hand on that greater troch, that's where that glute min is. Now that I've palpated the muscles that I'm going to be feeling for, we're going to go into the manual muscle test. So I'm going to have you straighten this top leg for me, okay? Keeping my hand where the muscles are and where I'm going to be stabilizing is at that hip glute area. I'm going to have you kick your leg up and back towards me. So go ahead and kick your leg up, and then we're going to guide you back. Good. Automatically, that's a 3 because she was able to get in this position. From here, I'm going to have you hold this position. Don't let me push you down, okay? I'm going to apply gradual pressure, okay? And hold, hold, hold. Good, and go ahead and relax that leg down. Okay, so she was able to hold with the gradual pressure all the way up to max pressures. She would get a grade 5. Grade 4 would be if she broke on moderate pressure. And then she automatically got the grade 3 because she was able to go up into that position that I wanted her to. And I'm gonna have you lay on your back for me real quick. Okay. Gravity minimized position. I'm gonna have her lay supine, legs out straight. She has some pretty like movable pants, so she could glide pretty easily. I'm still gonna be palpating that side of your glute where those muscles were. Again, find that greater troch, which is that bony protuberance. And then I'm gonna have you slide your leg out towards me, and then back to the center. So her leg would stay on the table. That would be a grade 2, and I felt the muscle contraction. She's able to go through that range. Grade 1 would be if I just felt the muscle contraction and there's only slight movement or no movement at all. And then grade 0 would be there's no reaction, no muscle contraction. And then obviously for all these tests today, the ankle subtalar joint range of motion and the hip manual muscle testing, abduction manual muscle test, I would make sure to test bilaterally.